Hi. Welcome back to Mindflux. A lot of people don't know much about Tourette syndrome, and it's no wonder. This disorder is relatively new to many people, including doctors who are just now starting to understand the causes and symptoms. Tourette syndrome is a neurological disorder that causes the sufferer to involuntarily make repetitive movements and sounds. It can affect anyone at any age, but typically develops in children between 5 to 7 years old. Symptoms usually include saying words or phrases out of turn or making noises, such as throat clearing or grunting. The condition goes away for most people over time, but it can be debilitating for others. For more information on Tourette syndrome, including what it is, how to prevent it, and what treatments are available, then watch this video till end. Let's jump in. What is Tourette syndrome? Tourette syndrome is a neurological disorder that causes uncontrollable muscle contractions, called tics. These tics are often characterized by vocalizations and can result in facial expressions or limb movements. There are still many unanswered questions about Tourette syndrome. The exact cause of this disease is not known, but scientists believe that factors like smoking during pregnancy, genetics and environment can contribute to the disorder. Neurotransmitters in the brain such as dopamine and serotonin might play a role in triggering symptoms. We have listed down 5 symptoms. Number 1. Inability to suppress repetitive, stereotyped movements. Number 2. Repetitive vocalizations and the uncontrollable use of swear words or inappropriate language. Number 3. The tics can be simple motor tics like eye blinking, head jerking, neck stretching, etc. Complex motor tics such as touching other people's body parts without permission or jumping from one foot to the other for no reason, or vocalized sounds like grunting noises. Number 4. Repetitive movements, like touching objects over and over again. And number 5. Seizures. Is Tourette syndrome curable? Well, Tourette syndrome is not curable, but it can be managed. There are things you can do to prevent Tourette syndrome from developing in children, including eating healthy foods and avoiding smoking when pregnant with the child. If you have tics, there are medications that may help. Find out the triggers for your tics. This will help you avoid them when possible. There are a number of treatment options for Tourette syndrome, including medications and therapy. The goal is to manage symptoms so that they don't interfere with the patient's daily life. Medications can be used to help reduce tics or other symptoms associated with Tourette syndrome. Make sure to take medication as prescribed by your doctor, even if there are side effects or other issues with the medication. Learn coping skills like deep breathing or holding something in your hand while you go through a tic episode. Here are some common types of therapies for Tourette syndrome. Number 1, behavioral therapy. It helps manage the symptoms of Tourette syndrome. Number 2, cognitive behavioral therapy. It is often recommended as an adjunct treatment for people suffering from Tourette syndrome. Other therapies include neurofeedback and virtual reality exposure therapy. That's it for today. Hope you enjoyed this video. Don't forget to like and share this video and subscribe to our channel. Thank you for Mindflux.